Hi, everyone, and welcome back to another episode of the Mission Brain podcast. I'm your favorite host, Ali Azan Ahmed, right from Karachi, Pakistan. And today we have a very special guest with us, Dr. Sophie Diharbiman. Dr. Sophie, I'm going to go ahead and introduce you. Dr. Sophie is a board certified endovascular neurosurgeon and founding partner at NeuroCare Clinic at Hospital Angles Universidad in Mexico City, where she serves as the stroke coordinator. And here's the best part about it. Dr. Sophie is passionate about advancing treatment for neurological vascular diseases in Mexico. Through her initiatives, she promotes public awareness for stroke prevention, most notably organizing events and, forgive me for my Spanish, Ictus una carrera contra el tiempo. It's the first time I'm doing it. That's the course in collaboration with global experts. Her expertise also extends to medical digital marketing and community outreach, further supporting her goal to improve neurological health science services in Latin America. Dr. Sophie, welcome to the show.
Thank you so much for having me today. I'm so excited about it. So I think you said everything in the introduction. Yes, I'm from France, actually. I was born in Paris, and yes, I'm in Mexico since like 2005. Yes.
Fantastic.
So,
Since we're on that topic, Dr. Sophie, we did the professional introduction, but here's the question we like to ask all our guests. How do you describe yourself? How do you introduce yourself?
okay, so I am a French girl, now Mexican. And as you said, an endovascular neurosurgeon. I fought for my dream like for more than 20 years now. And I'm actually doing what I love. And that's it, I think.
Amazing. Dr. Sophie, you're an inspiration to so many of us, and we love seeing you as part of the Mission Brain family. And we send out a list of questions, and we have very tough questions. Our viewers send very tough questions. Are you ready?
Okay, let's go.
Perfect. So the first question is, you've built a career at the intersection of clinical excellence and systems leadership. What first drew you specifically to endovascular neurosurgery and stroke care?
Okay, yes. Wow, what can I say? What's why in endovascular neurosurgery specifically, you tell me? Oh, okay. So when I was a child, there is no doctor in my family, no one in medicine, nothing, okay? But since I was like three years old, I loved the body, I loved medicine. I wanted to discover something. And so I was so attracted by the heart, and I wanted to be a heart surgeon. I wanted to perform open heart surgery and everything. But when I was 15, my cousin had a brain tumor, a meningioma, and he had a surgery. And so I discovered that we can operate on brain. And I was like, wow, gosh, that's what I want. And then, so I start to dig in neurosurgery and search everything about that and everything. And then I discovered the part of vascular surgery and the aneurysm and the AVMs and DAVF, everything of that. It was like, wow, this is amazing. This is, in vascular surgery, there is an urgency. It's like that. When there is an event, it's in this moment. You have to resolve it in this moment. So I started in this way, and then I discovered the endovascular parts of the vascular neurosurgery. In France is different. Endovascular neurosurgery, it's not neurosurgery, it's radiology. And a lot of country in the world is this way. There are radiologists performing endovascular neurosurgery. So I wanted to be like hybrid and to be able to make both part of this world, of the vascular world. You can do the open part and you can do the interventional part. So, and you can mix both. So that's why I loved it. I love this part. The urgency, I think.
Dr. Sophie, that is such a powerful story, and that is so inspiring to hear. But I just want to follow up on one thing that you mentioned, which is the urgency that is involved with endovascular neurosurgery. And I have a follow-up question to that. Being in Latin America and with the associated urgency of your field, what are the challenges specifically in Latin America that you face?
Okay, so I can talk a little bit about, of course, about Mexico, maybe some other part in Latin America, but here in Mexico, our health system is it's a little bit broken. We have to tell that. I'm actually now I work in private practice because in the public system we don't have everything. We don't. There is a lot of people, and this is a broken system. So when there is an emergency, sometimes people they don't know where to go. Of course, the private part it's really expensive. We can deny that. It's really, really expensive. It's sometimes when people call me, my mother have a stroke. Okay. And I can tell where to go in the public part, go there, but I can do more than that. And in the private part, it's really expensive. So it's a little bit difficult in this way, but what we are trying to do in the first part is to educate the population because, everyone knows how to recognize a heart attack, but not a brain stroke. So with and in every day, in my everyday life, in my consultation, and with all of my patients, their family, I try to educate them about if you can see someone was starting to speak like a drunk people, or if they can't speak, or you can ask them, sorry, to elevate their arm if in one drop, everything of stroke. So we're trying to educate the population because a lot of time they're going to the hospital, but it's too late for everything, including the late window we have now, like you can see in the Dawn studies or other. But yes, this part it's where we can do something and change something, because yes, we need to educate the population. And here in Latin America, so this part is difficult because I'm in Mexico City, so it's different, I think. But if we talk about, I don't know, Chiapas or Chihuahua or other region of Mexico, Mexico is a really big country, and there is some people that don't have access to anything, anything. So we are working on that to cut this difference and to try to give everyone a good medical attention, especially in stroke.
That's lovely, Dr. Sophie. And I just want to follow up on two things. You discussed about being in private practice, but you also discussed about patient education. Now, the general idea amongst people in medical medicine and healthcare is that once you move to private practice, you become distant from public healthcare. But we've seen in your case that even being in private practice, you've been super connected with public healthcare. We're making sure that you bridge the gap between healthcare. And we've also seen that you work closely with LMICs in development of things that forward healthcare in these areas. So how do you take those two together? How do you balance the two together? And how can one being in private practice still continue to serve their community?
Okay, so being in private practice here in Mexico maybe is different from other countries, like in United States, but I'm like the owner of my time. So yes, I have a lot of work, thanks God, but I can do what I want. And I don't want only to treat patient in private practice. It's not only that, we have to retribute to our community too. So I can divide my time. I can try to manage this kind of events we can do for public health, and for example this podcast, no, we had some difficulties last week, and yes, but we can juggle with that. So it's only a matter of you have to make the priority of what you want.
And I think, Dr. Sophie, that's the highlight of the episode. Make the priority of what you want. And I think that could be the caption as well. But moving on to the next question, Dr. Sophie, we did some digging and we found out that you work closely with students and with student mentorship. And we want your thoughts on what you feel is is the one thing that neurosurgery trainees or neurosurgery residents need the most that programs today might be missing.
Wow. Okay, so yes, I love to be here with students because they force us to study more and to know more. So yes, it's a big part of my life. And what do we need? We need more humanity, I think, to remember that every patient, for us, it's like the everyday. It's a brain tumor, it's an aneurysm, it's something we do every day, but for the patient, it's the first time. So we have to remember that the patient, their family, their relatives, they are going through something awful. And normally it's something that happened really fast, so they don't have time to adapt. So we have to remember this part, I think, and that's what I say to my resident, to my students. The patient is a human. Imagine it's your sister, your brother, your mother, father, etc. Sometimes we want to do something because we know we can do. What I mean by that, it's like someone with a stroke, a really debilitating stroke. We can do a lot of things, yes, but we know that the result is not going to be the best, the better. So sometimes we need to speak with the family and tell them, okay, we can do that. Yes, we can save his life, maybe, but you're going to have a lot of rehabilitation, a lot of difficulties after that. We need to be aware of that. And sometimes I ask the patient too that, I mean, the family, no, but do you have someone who's going to take care of him or her? And because they need to imagine that. It's the part, but we also we need to say that in the best human way and empathetic way, sorry. And that's the part I try to transmit to give to my students, this part, the much human part, because the other part we now have AI, we know a lot of stuff in internet, we can the book, the notes, everything, it's more easy than earlier. But this part, I think it's where we need to work.
Absolutely,
And
Dr. Sophie. And I think this advice goes through all careers, I think, across
yes, yeah.
neurosurgery as well, having the humanity of things. And I'm so glad you mentioned that because that's one thing that we're trying to build through this podcast to provide or to create this sense of humanity across borders. So I'm very happy that you mentioned that. Moving
Mm.
forward, Dr. Sophie, and I'm going to take another go at this. Your initiative, Ictus, una carrera contra el tiempo. Please correct me if I'm wrong.
Ah, you're
Please,
perfect.
we're dying to know about it. What's the goal? What's the project?
Okay, this project started like 2 years ago, if I remember, 2 or 3 years ago. I wanted to educate on the ictus, on the stroke. Ictus in Spanish is stroke in English, okay? So, as I said earlier, we don't have education about that. We don't know. Among the medicine, the medical community too, I have a lot of colleagues like ophthalmologists, uh, uh, surgeons, everyone that there is a stroke, we can do anything after 6 hours or 4 hours, or they stuck like 10 years ago. And now we have new guidelines. We have a lot of possibilities with endovascular neurosurgery. We have new catheters. It's amazing what we have. So I wanted to educate our medical communities and, of course, student communities and people in general about that, what we can do with a stroke and what we can save, because every minute we can lose a lot of neurons, billions of neurons in a stroke. So we can save them. We can try to reduce the damage. It's like, see, damage control we actually do in a stroke. And now we have some new medicine too. We have TNK. We have There is so much new results for the stroke, and we're going to have more. And then now we have AI, and it's a lot of possibilities. It's a world of possibility we have now. So the initiative of Ictus Carrera contra el Tiempo, it's a stroke. It's a race against the time. And it started with that idea to educate the population. And I have different specialists in the stroke care, not only endovascular neurosurgeon, because we need a really big team since pre-hospital. In the ambulance, we need someone who knows about that. And then the after of the stroke, the rehabilitation, and all of the psychological part too. So that's the idea of this initiative.
Wonderful. And Dr. Sophie, I don't know if you remember, the Mission Brain Hackathon last year had stroke as its theme, and we took a patient out of Mexico. And a lot of our participants mentioned, and their projects were based around your ideas. And we're very happy to see that ICTIS has been this inspiration for a lot many innovators and a lot many people who want to change stroke care where it's most needed. So we want to just thank you for doing all the amazing work that you do. And I think ICTIS just highlights your service and dedication to stroke and your community. On that note, Dr. Sophie, let's move on to the next question. There's a very interesting thing that I noticed in your resume when I was doing my research is that you did an MD, you're an MD, and you also have a master's in science, but you also have an MBA. And that is a very unique combination. I just want to ask you, how did the two come around, and how does having an MBA help you with the work that you're doing today with neurological devices and advancing neurological care?
Okay, yes, you did your research. Yes. When I finished the residency, I was actually going to Denver in UCF, to do a fellowship in skull base. But we had an epidemic, we had COVID, and everything goes down. So I had to search some other option. And then I studied the master in science. I did it in glioma, research in glioma. And during the pandemic, it was really, really hard. And then because maybe it's some, maybe I'm going to say something funny, but I have ADHD, so I need to dope my brain every day. I need something new. I need to search something. So meanwhile, I was in the master in science. I decided to do something in administration in because I'm in private practice, I need these parts because, I don't know everywhere, but here at least, we don't have any education in administration, in business, in how to make that work. So I wanted to do something exclusively in health and in direction, and to to have my clinic and know how to manage my clinic, and how can I use that for growing, for uh, have more impact in my community and everything. So that's why I did both of my master at the same time during COVID. So
Amazing, amazing.
yeah.
And Dr. Sophie, we're going to move to the last question. You're doing great. I think you're one of the best guests that we've
Thanks.
had. And the
Okay.
last question
Thank
is,
you.
looking ahead in the next 5 to 10 years, what do you feel are the biggest opportunities for stroke care impact in Latin America?
Great question. Really, really great question. And the answer is not that easy. So I think we're going to grow thanks to AI. I think with telestroke, with distance attention of patients, we can make the difference in Latin America, in Mexico, and we are working on that to reach the more the more the community that the poorer community, and to reach everyone where we can with maybe I don't know telestroke or AI, or we have to find and fill the gap we have in this medicine we have in Mexico and in Latin America, I think. But yes, I think we're going there. The difference between AI world and the AI, no AI world, you know. I think in 10 years we're going to be in another level. You know, I don't know if you see there is a my dream here in Mexico, and
Mhm.
for in 5 years, I hope we need stroke ambulance. Have you seen that? They
Not
have a
yet, but
CT scan in the ambulance. It's a stroke unit on an ambulance. It's like amazing. I will send you it's by Siemens. It's amazing. You can treat a patient directly in the ambulance.
wonderful.
Start the treatment, I mean. So can you imagine that? We can save a lot of billion of neurons. So this is my dream for in 5 years and maybe in 10 years to have access in every village, every city in Mexico have access to a stroke unit.
Dr. Sophie, that is so inspiring to hear. And we're gonna put a link on top of this video for that ambulance that you mentioned. And it's so amazing to hear your work and your dream in terms of helping patients with stroke care. And you didn't, and I think you're an inspiration to all of us here at Mission Brain and even beyond. So we just want to take this opportunity to thank you and thank you profusely for all the work that you do. And with that note, we're going to end our episode, our Sophie. Thank you for being on our episode. It was a pleasure hosting you. And I think the best way to end is by saying thank you, gracias, and merci beaucoup.
Thank you so much, Ali. It was amazing to be here. Thank you for the invitation. Thank you for everything. I'm so, so happy and excited to be part of Mission Brain. And anytime you want, I'm here.